A special good morning to you. My name is Jessie Leonce. In studio with me, as usual, Mr. Carlton Cyril, and we have for you this morning's COVID-19 response report. We're opening with a very important interview this morning, and we do hope you could stay tuned for the latest updates coming from a special department from the Ministry of Health and Wellness. We just want to give you some quick information before we get into the meat of things. We are reminding you that we are in a water-related emergency on island, and there have been prohibitions put in place by the government of Saint Lucia to ensure that we conserve water at this time. Saint Lucia is now in between phases at this time. We are in the process of reopening our country to ensure that we can find some balance between our economy, getting our economy going once again, as well as keeping our country safe and healthy, safe at least from COVID-19. Carlton?
Merci Jessie. Et puis bonjour pour vous. Toujours un plaisir pour nous et puis nous. Quand la côté mon service ici, c'est headquarters COVID-19. Ici, nous avons information développement qu'on y a fait, qu'à tient nous et courant et tout ça qui n'est pour fait et puis COVID. Par pièce différence. Bon matin, nous avons vu faut changer nous dans état des secours parmi l'autre bagaille. Bon matin, nous avons commencé, ouais ensemble et puis nous plus tard nous ni et puis nous docteur et ben Jessie qui parler baliek. Après ça ça va avoir une explanation et nous allons en plus de détails là fini pour conversation nous avons bon matin. Encore merci tellement especially pour ces gens qui sont sur internet, ces gens qui l'autre pays nous a dit bonjour de manière qui spéciale, nous a dit sans eux il pas possible. Toujours un plaisir pour nous ici.
Thank you very much for that. I'd like to now welcome in studio Dr. Francois. She's the epidemiologist at the Ministry of Health and Wellness. A special good morning to you.
Thank you. Good morning. Pleasure to be here.
Thank you very much for being here. I just want to go back to the data trends that have since guided our response to COVID-19 so far in Saint Lucia. Can you just speak to the figures in Saint Lucia and what are the implications for us right now? We're seeing the reopening of the country. What does it mean? What do the figures mean in terms of us being able to reopen?
Okay, so good morning all. In St. Lucia, as many of you know, we have 18 confirmed cases of COVID-19. So these are persons who have had a lab test done and they have come back positive for COVID-19. Our incidence to date is approximately 10 per 100,000, which compared to the rest of the region is pretty good. We have had over 900 persons in both quarantine and isolation. So this really speaks to, excuse me, what is being done on the ground by our healthcare professionals. Currently in quarantine, we have over 200 and roughly 250 to 280 persons in quarantine, and this includes our individuals who have returned, our returning nationals, as well as locals who may have been in contact with COVID cases. We also have approximately 67, 68 persons who are in isolation. Sorry, and these are individuals who manifest signs and symptoms, be it the cough, the fever, etc., who we are testing and currently awaiting results. So based on what we have seen on the ground, our numbers are pretty low. We have not had any COVID deaths, and let me add that our deaths, any suspicious deaths, we test them for COVID-19. These individuals, if they die in the community as well, we test them. So anything mildly suspicious, any suspicious deaths, they are tested for COVID-19 because we want to be really sure that when we report 0 deaths that we are doing so accurately.
Understood. And in addition to that, the standard contact tracing protocols, in addition to that, can you tell us what that has yielded?
So contact tracing is really a public health activity where used to contain any infectious disease. What it entails is identifying a confirmed case, a person who has been diagnosed, and removing that person from the setting and placing them in isolation. Now, you would appreciate for the virus to continue spreading, it would need a host. It would need for that person who is infected to come in contact with somebody else. And so by removing that person, first of all, you limit the number of persons that they are now going to be in contact with. So the virus itself does not have any other host to move on to. And then what we do is find whoever now has been in contact with that infected individual, and these persons are placed in quarantine. Now, by placing these individuals in quarantine, what happens is basically the same principle. If they happen to develop signs and symptoms, they are already by themselves. They already are not in contact with anybody else, so the virus does not spread. So that is the basics of contact tracing, and which is what we use really to prevent the spread of COVID and any infectious disease.
Okay. Now, epidemiologists, if I'm wrong, you could just correct me, are sort of disease detectives, right?
Yes, so to speak.
So can you just tell us how COVID-19 has been manifesting so far, and tell us how it has manifested in St. Lucia specifically? Because some persons are querying, they're seeing so many people dying abroad, they're like, ici a niño COVID, a lot pain, a lot COVID. So if you could explain how it behaves, perhaps?
Research is still really ongoing about COVID. It's still relatively new, and from what we have seen, it tends to manifest differently in different countries, in different populations. So, for example, if I may pick on one country, where you have older persons, and older persons tend to come with more comorbid diseases, with the diabetes and with the hypertension, with the heart disease, etc. You tend to see more deaths in that population. Whereas the younger populations, places with real young populations, they tend to manifest, you don't see these deaths. In St. Lucia to date, COVID has manifested very mildly, and I don't want the public to let their defenses down by me saying so. We are very pleased that we have not seen these complicated cases that require ICU or severe cases. Our cases have all recovered. They are doing quite well. They range from fever and cough, in some cases, to persons who have a very, very mild cough that normally they would not have gone to the physician for, but because they were aware of COVID being circulated in St. Lucia, they did decide to go in. So to date, and I think in most of the region, it has manifested quite differently. We are not seeing the number of cases or our healthcare system being overwhelmed, and we are happy with that, but we still urge persons to take the necessary cautions and do not let your guard down.
Okay, we are speaking to Dr. Michelle Francois, the National Epidemiologist, and today is another installment of the COVID-19 Response Report in studio, and with this information we do hope that you continue to practice all of the necessary measures that are needed to keep COVID-19 at bay. We continue with this interview on the other end of this break. Stay tuned.
Coronavirus? I am worried, Gassa. It's only old people dying from that.
Hold up. Being young does not mean being safe. Yes, it's true that the elderly are at higher risk, but anyone can get the virus. The effect is even worse if you have a chronic condition like hypertension, heart disease, lung disease, and diabetes, or weakness in your immune system. If you are living with these conditions, be extra careful. Wash your hands with soap and water. Use hand sanitizer with at least 60% alcohol when hand washing is not possible. Avoid touching your face. Take steps to boost your immunity through proper nutrition, exercise, rest, and take your medication as prescribed. Limit being around people who have flu symptoms, even close family members. Our health is in our hands. Together, through simple actions, we can stop the spread of coronavirus. This message was brought to you by the Bureau of Health Education of the Ministry of Health and Wellness.
Thank you so much for staying tuned. We are continuing with today's COVID-19 response report here in St. Lucia with our interview with Dr. Michelle Francois. She's the National Epidemiologist at the Ministry of Health and Wellness. We continue with our discussion on the risk of, a COVID-19 outbreak in St. Lucia. I mean, it doesn't take a scientists to understand that it was imported into St. Lucia. Can you speak to our risk as it stands right now, and what are the potential implications for reopening our borders at this time?
Right now, I think we've indicated quite a few times that although we have not had another confirmed case and our numbers are fairly low, we are by no means saying that there is no COVID-19 in Saint Lucia. We have sort of changed our testing strategy and our surveillance as well to try to detect more cases. And finding more cases is okay. It means that our system is working. So currently, being borders closed, I think we are in a pretty good state in Saint Lucia. Now, we are still a very susceptible nation. As I said earlier, we have had only 18 cases, which means that, our population on a whole has not still been exposed to COVID-19. By opening our borders, of course, we stand the risk of another imported case and COVID-19 circulating in Saint Lucia. The Ministry of Health, I think the government of St. Lucia on a whole is very cognizant of that. And we are therefore putting in place a number of measures, strengthening our port health, working with the hotels and the various sectors to ensure that once our borders are opened, we are able to manage, to detect early, and to put the public health measures in place to ensure that we do not have a massive outbreak of COVID-19 in St. Lucia.
Okay. Can you speak to the effectiveness of, we've been hearing the use, wear the mask, 6-foot distance. Can you speak to the effectiveness of these measures for the population at this time?
We believe that the success of the region has been in the early implementation of a lot of these measures. From very early o'clock, we kept abreast of what was happening around the world, looking at areas where the COVID-19, where the incidents had been increasing, looking at our arrivals into St. Lucia. We strengthened our port health. We started putting in place certain restrictions for certain countries with a high burden of COVID-19. And I think to a large extent that in itself restricted entry of COVID-19. I mean, obviously it did not restrict every single case, but I think that was a very good measure on behalf of St. Lucia and the rest of the region. I also think that during the periods that we had our partial and total shutdown, those were very much warranted when we were able to actually go out in the field and do the necessary. And I spoke to contact tracing earlier. Persons were at home and we were able to find persons, pick them up very early and place them in quarantine, thereby breaking that transmission cycle. So the mask, the hand hygiene, these measures play a key role in prevention of COVID-19 and breaking that transmission cycle. And it is something that I would ask the public to, it may seem simple to you, hand sanitizer, hand washing, the mask, but every little one plays such an important role in restricting or reducing transmission of COVID-19 in St. Lucia.
Okay, and that on a very basic level for each member of the population to practice.
That's right.
But in terms of the organization level, we've seen the phased reopening of the country with businesses being reopened and the economy is running, chugging again. Can you speak to the recommendations that have been made from your office in terms of controlling the spread or preventing, future occurrence for institutions, businesses?
Well, we have, as a ministry, we have sent out guidance to all establishments, speaking to workspace for individuals, as well as we keep enforcing the hand hygiene and the cough etiquette, etc., the wearing of masks. We have also, within the guidance, we speak to persons coming in ill. And of course, we ask persons to maintain that social distance. So the guidance has gone out to all of these establishments in the hope that persons try as much as possible to abide by them. We understand that it's not going to be business as usual, that there may be some hindrances and things may not flow as we are used to. However, think of it as doing it for your family, for your mother, for your sister, for your brother, who, if they do get COVID-19, may not be able, because of their immune status, may not be able to withstand. So it's a change. COVID is here to stay. It is really a change in thinking. It is really a change in behavior right now. It is not business as usual, and we're asking you to please adhere to these guidelines, to these protocols, in order to avoid as much as possible further transmission of COVID-19.
Should we expect more COVID-19 cases? We've heard from the Ministry of Health and Wellness that we should. We should be able to anticipate it's coming. Can you just speak to the Ministry of Health's response in the event of, an outbreak, increased cases going forward?
We definitely should. As I indicated earlier, by no means are we saying there is absolutely no COVID-19 in Saint Lucia. By expanding our testing, we are hoping to pick up more individuals, and we have individuals coming in through all routes. We have persons coming in, as Marine Police keeps pointing out, through the back door. We have no idea how many persons have come in, and we have not detected. We have no idea how many persons come in, but those that we do get, these individuals are placed in quarantine and are monitored. As I said earlier, also with the opening of the borders, we do expect cases. When you look around the world in the larger countries, they are still going through some major outbreaks. And so by opening our borders, there is always the possibility of a case arriving at our shores. What is important is the measures that are being put in place to combat this. And also we have our range of indicators where we monitor. And of course, if we notice, we have our thresholds, and if we notice that the numbers in terms of our admissions, in terms of the number of cases, in terms of what we are seeing at the healthcare facilities, if we notice that there is a change in any of these above what is expected, then by all means we would revert and put certain measures in place to restrict that. The goal is always the health and wellness of Saint Lucia, so we continue monitoring, and we ask the general public to work with us as we try as much as possible to manage the COVID-19 response.
Okay. St. Lucia's position as compared to the wider Caribbean, OECS, CARICOM, can you speak to our profile and speak to where we're at right now? I believe last we spoke to the OECS head of health, she said we're very exemplary, St. Lucia is exemplar in its efforts.
By all means, as I indicated, our incidence has been approximately 10 per 100,000, which is actually the lowest in the Eastern-speaking Caribbean. In terms of deaths, we are among the few countries that have not recorded deaths. We have a few islands, our sister islands, who have recorded deaths. Nothing too alarming. However, we are quite proud of how we have dealt with the situation to date. I think the entire region is trying to build capacity as it pertains to testing. We have resumed testing locally, and that is a big step for us, because we are really hoping that by doing so we reduce the turnaround time and we are able to pick up more individuals. So overall, St. Lucia has, compared to the rest of the region on a whole, let me say, has been doing very, very well. Very well compared to what we see in the more developed countries. But St. Lucia has been doing quite well, and our hope is that we continue working in that manner and we continue pushing forward.
With increased incremental operations and us moving forward towards the full reopening of our society, there are the concerns that what if we do have an outbreak? What if we do even better than we expected? What are the triggers to revert to previous phases, and what are the triggers to advance to higher phases in terms of just reducing our overall concern and anxiety with regard to COVID-19? We talk more about that when we come back. We're due for another break. Stay tuned.
We at war with a virus, ready to harm us. Panic is not the answer. We can win this together.
Often use hand sanitizer. Better yet, use soap and water.
We must protect each other
if we had to beat this corona.
Together let us win this war. Be a soldier for Saint Lucia. Together let us win this war. Be a soldier, together we can beat this corona.
So you don't become the next case. Avoid touching your face. I'm sure you've been told so. Handshakes and hugging are up. No, no.
Advice give you the please. Cover your mouth and your nose if you cough or sneeze.
Practice social distancing and avoid large social gatherings.
Together let us win this war. Be a soldier for Saint Lucia. Together let us win this war. Saint Lucia, be a soldier. Together we can beat this corona.
For further information, please contact the hotline at 311 or the Bureau of Health Education at 468-5349.
Thank you so much for staying tuned. We continue with this morning's COVID-19 response report, speaking to Dr. Michel Francois, the national epidemiologist. Amid this whole COVID-19 crisis, fortunately, St. Lucia has been able to advance to the reopening of its economy, reopening of its society in full come the first week in June. I just want to query from Dr. Francois, what will be the triggers to revert to a previous phase, perhaps when St. Lucia was on lockdown, perhaps, we were on the 24-hour curfew. What would it take right now to have us revert to that period?
So we have a list of indicators, which I will not go into every indicator right now. But we did come up with a list of indicators which would inform us of where we are. So we have our baseline. This is where we are at currently. And we're looking at indicators such as an increase in incidence beyond a certain point. We're looking at our ICU admissions. Currently, we have, as I said, established our baseline, but we're looking for any increases beyond that baseline. We have also done projections in terms of the number of cases that we expect over the next few months. So any increase beyond these cases for that period of time. And of course, it's not just an increase in cases, but we also have to look at whether these cases have an epidemiological link. So for example, if we detect, say, 10 cases, and these 10 cases are linked to a household, that is totally different as opposed to having 10 cases scattered around St. Lucia, where you have to now go and find where that source was. So if there is no epidemiological link and we have that number of cases, then by all means that is a warning sign, which means that we have had some level of spread as opposed to it being limited to a particular household. So we continue to look at hospitalizations, the number of severe acute respiratory illnesses that come into our country, and these are things that we monitor on a weekly basis at the epidemiology unit. So these are the things that point us and let us know that what is happening on the ground is nowhere compared to what we have seen in the larger countries. We will continue to monitor it, and we will continue to remain alert for any increases, anything out of the ordinary, and of course that will hint that certain measures need to be put in place for us to revert.
Hopefully, God willing, what would the development of a cure of a vaccine do for countries like St. Lucia?
Well, we definitely, I think the world is waiting for this. We look at H1N1, influenza. We had an outbreak. There is now a vaccine. It's annual. We ask persons to get that vaccine every year, and it really does help in preventing, especially for our most at-risk groups. Seeing what COVID-19 has done, I think the world on a whole is really looking forward to that vaccine or to some form of treatment for COVID-19. Hopefully, if that happens, we have no idea on immunity. We do know that the body does mount a response to COVID-19 because we do get antibodies and there are tests. However, what we don't know is how long that immunity lasts. So that would be a key factor in determining that, and we await what, be it the vaccine or a cure. But it would go a long way seeing what we have seen in the larger countries.
Okay. Overall, can you just tell us the significance of your office, Epidemiology, in the fight against COVID-19? It's a novel virus, and a lot was not known about, not much was known about COVID-19 in the early stages. So just tell us about the significance of epidemiology in terms of gathering data and so on, in terms of fighting COVID-19.
So epidemiology is really a branch of medicine where that deals with the distribution of diseases, the burden of diseases, as well as dealing with or controlling the spread of particularly infectious diseases. So our role really, first of all, when it came on the scene, was to follow up, look at the burden of disease outside of Saint Lucia, what was happening outside of Saint Lucia, and assist in putting measures in place within Saint Lucia to control. I spoke earlier to baselines of what is happening in Saint Lucia, and by doing so, for example, we monitor influenza-like illness through our syndromic surveillance on a weekly basis. And so when we have something like COVID-19 coming in, we know it's a respiratory illness. We monitor what we do. We have our baselines and monitor what we do on a weekly basis to look for any increases or decreases, which would tell us, listen, something is happening on the ground. And when we see these things, we go out into the community to try to find out what is happening. Is it influenza? Is it COVID-19 that we have? But that really is our role. And based on the evidence, based on the data, it helps to guide policy and put measures in place to control and manage diseases.
Okay. Halifax University epidemiologist, a professor, I think, Dr. Susan Kirkland, she stated that COVID-19 was both a dream of hers as an epidemiologist and a nightmare at the same time. You know, it certainly gives you room for exploring, you know, your field, and also very concerning of the great unknown. Can you speak to what your personal experience has been to COVID-19 as an expert in this field?
I wouldn't say a dream.
In its study.
It has been, yes, in its study. It's always interesting when you see something novel. You look at its behavior and you compare it to what has been, where it came from. You know, it's a coronavirus. There have been so many coronaviruses. How did it originate? Its difference between MERS and SARS, and the very mild coronaviruses that cause just like the common cold. But on the opposite end of it, it has been tasking on the Ministry of Health, keeping up, because COVID sort of came, and because of the fear and the uncertainty, what was unknown, it sort of consumed everything else, because what we did not want were deaths. We were very concerned about COVID-19 and how it would overwhelm the system, our healthcare system, what it would do to our most vulnerable population. So it really consumed us. However, I think we put measures in place. We were able to move on with life, keep everything else within the unit, within the ministry going, but still dedicating enough time and effort on COVID-19 to ensure that it did not reach that point.
Okay. How confident is the Ministry of Health that the population has grasped the fact that COVID-19 is here to stay and it's going to be the new normal? Further, if you could just outline to us what this new normal is going to be in terms of the information that we're getting from the ministry.
I think overall, the public is coming to terms with what COVID-19 is, that COVID-19 has not totally disappeared. It is a message that we try as much as possible to keep bringing to them. I also believe that the new normal would be for us as a country maintaining the social distance, hand hygiene and cough etiquette, if nothing else remains but these, because we've seen in the past that we've had outbreaks of novel respiratory illnesses, and these are really the basic principles in control. So what I would really like to see, and it's not just for COVID, but there's also influenza. There are a variety of other respiratory illnesses out there that we do pick up on a yearly basis. Prior to COVID reaching, for example, the US, there was an outbreak of H1N1. So this is the basis of control of these illnesses. So what we would like to see is for these basic practices to be maintained, and this is what should be our new normal. This is what St. Lucian should take away, that it does not take that much hand washing, hand hygiene, avoid touching faces, that sort of thing, social distancing. I think these are key, and if we work together, I think our new normal will not be that abnormal, and it is something that can be sustained.
Okay, our new normal will not be that abnormal.
Yeah,
I like that. Cool.
Yeah, speaking of which, Jess, thanks. I would just like to ask, as it relates to our health system and in terms of where we are at right now, because we speak of, especially at the consultation, we heard going forward when we get to the new normal, which we speak of, what would be very essential is our boosting of our ports. Our health system, speak to our capacity as it is and where we are to date, you know, where we are. Speak to that in terms of, because what we are seeing is we were able to contain it, we were able to maintain, but I am saying, where are we right now?
Right now, we do have assistance, which we brought in based on everything that we saw. We realized that we did need to increase capacity. Right. So we did so through the Cuban collaboration, and we do have nurses and doctors, etc., working with us. However, moving forward, and with the reopening of the country, we are looking to boost particularly environmental health, because they do have a key role in this. We're looking to boost up our presence at the ports and put certain measures in place. We have also been working lab-wise when we build capacity for COVID-19 testing. This involved purchase of new machinery, new equipment, and new skill set for our persons. And this will not be restricted to COVID-19, but with the new equipment, we will be able to test a variety of other illnesses. So I think COVID-19, yes, there were opportunities, and we piggybacked on that to sort of strengthen our healthcare system. And with new ventilators coming in, the shift to OKEUH, and now have Victoria Hospital as a respiratory hospital, I think our capacity and our human resource, we have contributed significantly to that, and we have improved. And looking forward to post-COVID, continuing to build on that and making our healthcare system stronger.
And my final question before I go on interpreting in Creole all what we have to digest there for our audience. As it relates to, we heard the services in terms of DigiGov, where we see 8 ministries rather, across 154 services will be coming on our online, right? How does that assist in your regards to your unit in terms of, does it improve? What does it do to the unit, or are you guys already, you know, is there a foundation? Because I know it's a lot of testing machinery you speak of, and if we are going to go DigiGov and we're going to have a lot of our services online, you know, how does that assist your situation and your department?
Well, if we do have a lot of services online, it really assists in our response, because online means that persons are not in contact, so that you restrict that face-to-face interaction. I think it's our new normal. It's a matter of us getting used to it, working together, the different ministries putting in place certain structures so that the reporting and the communication is there and we're not off on different tangents. So I think it will serve to strengthen us. It's our new normal and it's just a matter of getting used to it.
Okay, thanks so much.
What we're going to do now is take a quick break. When we come back, Carlton will be tasked with translating our morning's interview. Do stay tuned.
Saint Lucia ka registre vermin corona ek I ka fait mouvement ek en chay vitesse tan chaque canef ka kouye pour vigilance publique la fait wolo parler en place publique qu'on bol en main base ti boutique changer distance sociale 6 pieds hod yon a lot I ka travay tan si ou senti ko pa cordial quarantine ko pas en contact et puis l'autre en cas où te toi pe exposé c'est un écouye free 11 ou ben n'importe clinique yo pou les pays a dimi à clé ça veut dire les supermarkets pharmacies et puis ATM yo accessible avant c'était souhait pays à clé en plein ça veut dire tout bagay fermé à 24 heures servi protocole comme sorti par bureau indication santé nous tout ensemble ça sauver vermine corona si nous toutes servi jidla à toutes les
Together let us win this war. Saint Lucia be a soldier. Together we can beat this corona.
Thank you so much for staying tuned. We are in studio live on NTN at the GIS studios speaking to Dr. Michelle Francois. She's the National Epidemiologist. Quite an essential, imperative, critical role at this COVID-19 juncture in our history, and we really do appreciate her taking the time to sit down with us and really explain and delve into, giving us data trends and how it plays into our response to COVID-19 overall. At this time, I want to hand over to Carlton, who will be giving the translation in Creole for our viewers right now.
Merci tellement, Jessie, et merci, Dr. François. Moi, merci pour vous qui écoutez. Moi, nous ni développement, comme moi toujours dit ici pour Baou, nous qui payons attention, point avertissement, n'importe information qu'il a expressément venu pour vous, parce que y en a ces bails là, docteur a bien parlé dit. Tout le monde est responsable personnellement pour faire assurer nous faire contribution nous quand ça fait by corps assurer ou ça aider l'autre monde mais ou ça assurer ou fait ça ou fait by corps quand docteur Michel François c'est lui qui epidemiologist et puis ça veut dire ça c'est monde qui est responsable pour vermine pour disease les nous ni en pays ça c'est centre qui travaille avec département bureau santé c'est monde ça yo responsable pour venir puis solution identifier côté ces problèmes là ces disease là et puis venir solution avec mettre recommandation by gouvernement recommandation avec mettre bagaille en place pour contrôler et pour faire assurer il pas si manger puis venir plus mal et ben fait pays à mener pays à de manière qui plie mal quoi yo kay hen remède yo kay hen ces vaccins nan nous besoin pour lui quoi ou kay bien comprendre là vini pour COVID-19 office qu'on nous a parlé puis docteur yon a ces bagaille là dit office li teni yon task et ça yo teni pour faire c'est qu'on attend toutes les c'est identifier qui ça y est ça qu'a fait l'autre pays et mettre bagaille en place là vini pour Saint Lucia quoi on nous commencer en parmi bay docteur Jadino là vini pour Saint Lucia nous teni 18 cas ça l'OVI en toute vision avec l'ouvrir la terre généralement nous a dit 10 par 100 000 c'est ça nous a tombé en bas catégorie ça 10 mon infecté par 100 000 parce que nous avons 100 000 qui choy en population nous et ça veut dire nous a fait bien tout bonnement. C'est pas qu'on nous capable voudoyer, mais nous qu'a fait bien tout bonnement. En quarantaine à présent, nous à présent à peu près 250 pour 280 moun et qu'on a changer ça c'est moun yo mené à sous bâtiment qui a travail et parmi yo aussi moun qui était au lieu moun yo trouvé testé et puis COVID-19 quoi. Là, nous sommes à peu près 250, 280. Là, il vient pour moun qui en isolation, moun qui peut-être kamouche sin, mais nous pouvons fin assurer nous sommes à peu près 67 pour 68 moun. Ça c'est moun qui ka toussé kamouche sin peut-être dans la fièvre nan bagay pas fin assurer si yo ni 20 maintenant quoi. En ça nous ni 67 comme on dit pour 68. Mais ça qui est bien important pour savoir, c'est moun sa yo ka tester yo ka vrai test là, yo ka espérer résultat ces tests ça quoi. Ça bien important pour vous changer. L'autre bagay là docteur touché un petit akassou c'est l'invini pour moun qui mort. Pas simplement c'est moun nan isolation mais moun qui trouvé ko yo testé qui yo ka met rapport à si yo moun mort yo ka fait examination aussi pour faire assurer moun ça pas té mort et puis COVID. Bien important docteur touchant titakasso les Jessica ka parler ba imande les vini pour nous ka vieux ouais côté moun nan té passé moun nan si trouvé ko testé les vini pour dire koité koumoun était en contact puis docteur dit yo a fait un chai progrès les vini pour ça et yo a identifié un chai c'est moun ça moi bien changé dans yon ces programme nan nous ici yo dit 12 c'est moun ça qui était trouvé ko yo affecté yo réunion ces communautés ces cliniques là qui établi mais ça nous a dit avec docteur a fait explanation c'est les vini pour ces moun ça si yo réunion moun qui testé